Welcome to Buddhi Clinic, India's first and only fully integrative neuro rehabilitation center. Here, we blend clinical neuroscience, rehabilitation expertise, and traditional healing sciences to create truly personalized recovery journeys for our clients. Let me take you through how we do it.
At Buddhi Clinic, we begin every journey with a comprehensive, multidisciplinary clinical evaluation, which is the foundation of personalized precision rehabilitation. Using gold standard, internationally validated assessment tools, our team systematically evaluates neurological, psychiatric, cognitive, functional, and rehabilitative parameters. What distinguishes Buddhi Clinic is our clinical efficiency without any compromise. In just 3 hours, our expert team completes 10 to 15 structured assessments, a process that usually takes several days to even weeks at other reputed institutions. This streamlined yet thorough evaluation ensures that every dimension of a client's needs is captured with depth, accuracy, and clinical rigor. By the end of this single structured visit, we are able to not only diagnose comprehensively, but also put together a fully personalized, evidence based rehabilitation plan ready to initiate without any unnecessary delays. At Buddhi Clinic, we believe that timely, structured, and complete assessment is the first critical step towards a faster and fuller recovery. Every client's journey is guided by a multidisciplinary team: neuropsychiatrists, psychiatrists, psychologists, physiotherapists, speech therapists, occupational therapists, and rehabilitation physicians, all working together to design a personalized care plan based on detailed evaluation, international scales, and your functional goals.
At Buddhi Clinic, we believe that the technology must transcend innovation. It should be clinically effective, evidence backed, and deeply patient centric. Our care model is future forward, built on the principles of precision medicine and integrative neurorehabilitation. Let me walk through you for some of the key technologies we deploy in the rehabilitation processes. Repetitive transcranial magnetic stimulation or RTMS and transcranial direct current stimulation TDCS are non-invasive brain stimulation techniques that modulates neural activity. These are powerful tools in treating depression, stroke recovery, movement disorder, cognitive impairment, and chronic pain. In essence, we use carefully calibrated magnetic field or microcurrents to nudge the brain circuitry back toward optimal performance. Vital stim therapy integrated into our speech therapy program is an FDA approved neuromuscular electrical stimulation technology. It enhances swallowing and speech function by stimulating and strengthening the relevant muscles. For patients with neuromuscular weakness, electromyography (EMG) biofeedback devices are employed. These enable patients to relearn muscle activation with real-time visual feedback, aiding motor recovery in stroke, traumatic brain injury, and spinal dysfunction. Functional magnetic stimulation, the FMS, is a non-invasive magnetic therapy that addresses chronic pain, example back and neuropathic pain, pelvic floor rehabilitation, which include urinary incontinence and post-stroke bladder dysfunction. FMS reactivates neuromuscular control without discomfort or invasive intervention. We go further, integrating emerging technologies with measurable impact. The QEEG guided neurofeedback, a real time brain training tool, allows patients to observe and modulate their brainwave pattern through a process of operation conditioning. It is particularly beneficial for attention deficit, anxiety, sleep disorders, and cognitive rehabilitation. TAVNS, transcutaneous auricular vagus nerve stimulation, is a novel non invasive method of stimulating the vagus nerve via the ear. Backed by promising neuroscience, TAVNS is showing efficacy in managing mood disorders, epilepsy, chronic pain, and inflammatory condition while supporting the autonomic nervous system regulation. New indications include fibromyalgia, cluster headache, migraine, and even post acute sequelae of COVID 19. The Hand of Hope robotic arm is a state of art robotic neurorehabilitation system that facilitate upper limb recovery and focus on fine motor function. It assists patients in regaining voluntary movement by combining EMG triggered support with robotic assisted training, especially in stroke, traumatic brain, and spinal cord injury rehabilitation. At Buddhi Clinic, we don't use technology, we curate it. Each modality is integrated into a comprehensive multidisciplinary care plan tailored to individuals' neurological profile.
At Buddhi Clinic, we understand that healing isn't just what happens inside a therapy room, it's also in how one feels, explores, and connects. Let me take you through the spaces we have thoughtfully designed to enrich recovery with joy, movement, and meaning. Our sensory garden is a serene, therapeutic outdoor space that stimulates sight, smell, sound, touch, and movement. Clients walk barefoot along pebble paths to improve proprioception and balance, explore textured zones to awaken the senses, and engage with aromatic herbs and flowering plants to calm the mind. This garden is a space of connection with self, nature, and healing. Let me tell you a bit about hydrotherapy. Water has a natural therapeutic effect, reducing stress on joints, enhancing movement, and boosting confidence. Our hydrotherapy tub supports physical and neurological rehabilitation by making movement easier and more fluid. It is especially beneficial for those recovering from stroke, Parkinson's, or spinal injuries. The creative therapy spaces include weaving, painting, expression. Healing is also about reclaiming expression. In our activity therapy rooms, clients engage in weaving, which improves fine motor coordination, and painting, a therapeutic outlet for creativity and emotional release. Bag making and dyeing, which combines sensory stimulation with task planning and execution. These therapies serve both rehabilitative and emotional goals, restoring skills, enhancing mood, and boosting confidence.
At Buddhi Clinic, care doesn't end with a diagnosis, it evolves every single day. Throughout the rehabilitation journey, we follow a structured care planning and review process. Our interdisciplinary team meets regularly: neurologists, therapists, psychologists, and physicians to review each client's progress, adjust therapies, and ensure that we remain focused on functional outcomes. Whether the goal is to walk independently, return to work, regain speech, or simply live with greater ease, every plan is personalized and refined in real time. This dynamic, coordinated approach is what makes outcomes at Buddhi Clinic both measurable and meaningful. As you've seen today, Buddhi Clinic is more than a facility. It's a community of care where science, soul, and service come together. We offer not just therapies, but a pathway to hope, recovery, and restored dignity.